Hi everyone, welcome to the 8th episode of the Public Health Podcast. We are Justin and Kevin from the Harker Public Health Club, and we are so happy to be joined today by Dr. Johannes Eichstaedt, who is currently an assistant professor in psychology at Stanford. His work centers around combating the issues in mental health using AI and social media data. In this episode, Dr. Johannes Eichstaedt discusses his work, which has become especially pertinent in COVID-19. The following is the discussion he had with us. Dr. Eichstaedt, thank you so much for joining us today. We were wondering that when we're learning about your work, it's clear that the field you're doing research in is really impactful and really pertinent in terms of helping the public health community gain more information about like the general well-being of the population in a scalable manner. So can we just start off with like your background in terms of your backstory and what inspired you to get into this field of psychology and mental health?
Happy to be here. Thank you so much for the invitation. Sort of modern scientific careers tend to be very interdisciplinary, and people change fields and they sort of combine different kinds of training. And so that's true in my case as well. I was originally trained as a physicist. I worked as a particle physicist, and then at some point in my life decided that I didn't care about particles and switched into psychology with a master's and then with a PhD, and then ended up combining lots of the data science methods with a psychology interest. And that's sort of where I landed. We then co-founded a somewhat large research group, the Well-Being Project, about 10 years ago. And the other part of science, other than that it reflects the different skills that you collected over the years, it's also you want to do science with friends. It's a team sport. And so I have lots of interdisciplinary friends over the years with which we build out these methods in computer science and in the social sciences.
That's terrific. We also learned that you co-founded a lab called the World Well-Being Project that measures well-being based on social media posts.
Mm-hmm.
How has your lab changed from before the pandemic to after? And what adaptations did the lab need to make during this time? And also, I'm wondering, as more and more people are getting vaccinated, what is the rate at which mental health is recovering? And when do you think the numbers could match pre-COVID data?
Yeah, that's a really good question. So let me take the second question first. So it's actually not COVID infections that has to do with people's mental unhealth. What drives people's mental unhealth are things like lack of childcare, unemployment more than anything, loss of income, anxiety. So it's really not about the vaccination rates. It's really about economic normalization, and economic normalization in terms of the labor force. So not stock market, which is a very poor index of how well people are doing, but who's the labor participation rate, as we call it, right? So what fraction of people is employed in jobs that have some social security benefits, that have healthcare. The US historically has a problem with people being marginally or underemployed. So they work 2-3 part-time jobs, but they still don't have healthcare when they go at home at night, right? And that's part of the reason why COVID has hit the mental health of Americans more so than, say, the mental health of Europeans, is because there's just no safety nets in place, except these emergency safety nets that were sort of cast out at the last minute with these giant bills. So the question when this normalizes is a little bit when the sort of poorest in the population are again looking at economic opportunities. That's really the big normalizing factor. And then when families have childcare again, that's a big one. And of course, vaccinations help with this, but vaccinations to some extent are sort of a bit of a leading indicator, right? Right now we have, as I'm sure you know, the economy is jump-starting in a way that's sort of bottlenecked, right? We've run out of lumber, we've run out of wood to build things, we've run out of used cars, right? Because when Hertz and the other rental car agencies almost went bankrupt last year, they sold off their fleet. So we have all these supply chain bottlenecks right now. So we're not out of the woods yet. There's big fears about inflation. So all of those things actually play into well-being. Well-being will be the last thing that adjusts, right? So well-being is very hard to move, and it's very hard to fix once it's broken. So I expect people to have money before they have their mental health back. And then I think you asked me another question. No, the other question was, what did you do with these methods around COVID or something? Something like that. Well-being project, something.
Yeah, so like your world well-being.
Oh, yeah.
Yeah, so we've been trying. So we of course jumped on this and tried to do something helpful for the population, and we tried to track well-being using social media, and quickly realized that it was actually very difficult to do, and that we didn't find our models to be very reliable in many ways. But then we did a little bit more public health stuff, seeing how different communities in the US make sense of COVID and how that's associated with higher risk rates, stuff like that.
Mm-hmm. Oh yeah, that sounds really interesting. So in terms of your personal research, it seems like you've been doing this part of like assessing sort of public health and mental health using like social media data for quite a while. And I was wondering if you could explain to our listeners sort of like the technical aspects in terms of how you're able to take, for example, like a collection of tweets and turn them into like through multiple rounds of data manipulations, the overall trends for the population.
Sure. Yeah. So, okay. So it all starts with the Twitter API, right? The application programming interface that you can query with Python code. And then, so let's say Twitter makes 1% of its tweets freely available. Let's say you thought of this 10 years ago and you put a grabber up that downloads the tweets that come as JSON objects with Python code, and you store them. Then you have to process that somehow. Like once you have those data objects, you then want to probably put them into some sort of database. In the early days, we're still doing this now, but you put that sort of into a SQL database, SQL database, structured query language, sort of the simplest possible way to do it. And then increasingly now we're all on the cloud. We're in the Amazon cloud, we're in the Google cloud, where the stuff gets stored. And this is sort of to the order of terabytes of text data, right? So it's not super giant, but it's certainly at a level where a workstation can no longer do anything with it. It's much too much. Okay, let's say you have the tweets. The tweets have a location field. The tweets have a text payload. And so we run the location field through a geotagging pipeline, right? So the location field says Scottsdale or something, and then we look up, okay, what Scottsdales are there in America? Okay, is 90% of the population in America concentrated in a specific Scottsdale? Yes. Okay, then we're going to make an inference that when people say Scottsdale, it probably means Scottsdale, Arizona. So we pin this onto Scottsdale, Arizona, and then we look up what county that is. There's about 3,000 counties in the US. And so we geotag the tweet to the county. Okay, you're with me? Yeah. Now, for a given county, we have a bag of tweets, right? This is it's a simple approach. There's more complicated approaches, but let's do the simplest case. So for a county now, you have, say, 100,000 tweets. Now you have text from a location, and you have, say, 3,000 or 2,000 of those locations of these different counties across the US. Now what you can do is you do a little bit of natural language processing, right? So you do feature extraction, you split the tweets into words. You can do this based on white space, but it's better to use these modern systems. They figure out what you mean with emojis and emoticons, and you don't have to use white spaces. They chunk this into what's called different tokens. And then you match your tokens against the dumbest possible version is you have a list of all the words or tokens that includes emoticons that you take to index a positive emotion, right? So this is very simple sentiment analysis. So you have a list of words, and then you compare the words in the tweets against it, and you say, okay, 5% of the words from this county are positive emotion and 3% are negative emotion, right? So this is sort of super simple sentiment analysis. And now you have a pattern of positive and negative emotion in these different communities. Yeah. Mm-hmm. And so we call that geographic variation, right? It varies with geographic location. And then you can say, look at that pattern and say, look, this pattern looks exactly like the pattern of heart disease. Right? And you can say, oh, look, in areas of the country where people are very stressed and very hostile are actually areas of the country where more people die of heart disease. even when you statistically control for things like income, that they have lower income or lower education or something like that. So that's actually true, right? That's actually the case. So this is a simple correlational analysis. And then on the other hand, you can then take, rather than just say positive and negative, you can have 1,000 of these language indicators, language derived frequencies, and you put them into a machine learning model. So either machine learning or an AI model, and say, okay, AI model, these are your inputs. What the CDC tells us the mortality rates from heart disease at the county level are your outputs. Now build us a model that takes us from the inputs to the outputs. And then, AI does its thing, tunes itself, cross-validation, hyperparameter tuning. And then you have a prediction model. So those are sort of two possible ways. And then if you come with a new community for which we don't have ground truth, we don't know what the mortality rates are, we can take only what we see on Twitter, we can give it to the AI model, and the AI model says, I think this is going to be the rate that you should expect here. That's sort of the outline.
Yeah, that sounds really interesting, because I was actually doing a similar research project just like on the side for fun last summer. I was using Twitter data to try to use natural language processing to predict COVID cases. And I think that just from my lay impression, that I sort of experimented with, is kind of, this process is kind of, there's a lot of challenges in there, because first of all, the tweet lengths are really short, 140 characters or something. And also challenges the usage of slang, and also sometimes sarcasm and stuff. It's overall quite hard to capture the meaning of tweets. So could you kind of speak to that in terms of how you're addressing these types of difficulties, and also to make the social media analysis more robust, and also how are we able to, as we're able to increasingly master this technology, what do you envision for the potential for the future in terms of social media AI analysis?
Yeah, that's a good question. So, okay, so first of all, I should say that, of course, there's sarcasm in the English language, but it's sort of less than 10% of cases when we looked at it 7 years ago, when we tried to quantify these sources of error. And the whole game is signal and noise, right? It's trying to find the signal and the noise. If you're aggregating a lot of signal and 7% of that signal is noisy, you don't care. Your models don't care. So the first answer is you can just overlook it. You can just ignore it because it's not that important. The second fancier answer is that everything I've described so far treats words just like bag of words, like they fall from the sky one at a time, and then you check them against the dictionary, right? There's a recent innovation in natural language processing called contextual embeddings, where you represent a word by a, say, 1,000-dimensional vector, and depending on which sense of the word you mean, this vector changes. So even though in the previous analysis, a word was a word, it always meant the same, and it was sarcastic, well, sucks for you because you don't know that, you being the language model, right? And with contextual embeddings, during application of the model, which is very computationally intensive, these are models that are trained on the entire internet, and only the big tech companies are now in the position to train these models. But once you've trained these models, they can distinguish the sarcastic sense of a word from the non-sarcastic sense, and actually capture that as a representation. And it does make the prediction accuracies better in the end, right? When you use that as an input in your model, it does make the model more accurate, but it's less of a jump than you might think. So on a sort of 0 to 1 scale, the accuracy goes from 0.4 to 0.45. Right? So you have a 10% boost in accuracy after increasing the complexity of your methods by a factor of 10. And so it's generally been an observation that that there's a sort of marginal utility of return, right? So the marginal rate of return for complexity in your methods. These things begin to approach an asymptote. And so, as much as I would like to tell you that with these next generation of AI systems, we can crack all of this and we get to perfect accuracy, that's just not empirically plausible, right? There is a lot of noise in the way people talk. There's a lot of noise in the way people behave. People are very complex systems. And language is one behavioral marker for what they do. And psychology is very used to the fact that if you look at the correlation, the association between how people behave and what they tell you they think on a survey or some other assessment, that those things only go together at a correlation of around 0.3. Correlations go from 0 to 1. And so these language models are at 0.4 or 0.45 at the community level for something that's subtle and for something that's really, if you're trying to predict income with Twitter, for example, that's a very strong variable, right? How rich a community is impacts lots of behaviors. These prediction accuracies get to 0.8, 0.9. But yeah, so these methods make it better, but the rate at which they get better is actually is falling off. Yeah, so what's my vision? My vision is that with these methods, we can bring measurement to places where otherwise you cannot have measurement, right? To poor places, to countries around the world where governments can't afford to send out surveys to every person, ask them about their well-being. And it gives me, the hope is that one day we have a measurement system that is in place that can respond in real time, right? Surveys can't respond in real time. And they're very, very expensive and miss many communities. And so the hope is that one day this will all be very accessible and very quick, but we're still a few years away from doing that. I should say that scientific projects take 5 to 10 years. That's your general unit of time commitment. So you sort of as a scientist get used to something taking that long to really be a solid advance and not just a single paper or a single project.
That's great. We also noticed in your virtual conference about coronavirus and AI from the Stanford Institute for Health Human-Centered Artificial Intelligence that misinformation, such as the coronavirus being like the flu, appears frequently in specific demographics. Do you think AI has the potential to sift through data to find misinformation? And is there a way to prevent the spread of misinformation about coronavirus centered around AI?
Yeah, that's a very good question. There's lots of colleagues doing related work. So there were these famous studies a few years ago, what causes the spread of misinformation on Twitter? And everybody's sort of initial hypothesis, it's the Russians or it's bots. Turns out it's people. So anytime you have information that is very exciting, and elicits strong emotions, we as human beings are more likely to share it. And so there is a hope, sometimes sort of there's a techno-optimist hope, right? We're in Silicon Valley, there's a lot of techno-optimism here, that technology can change and improve everything. And to some extent, it can improve quite a number of things. But the fundamental problem with the spread of misinformation is not user interface design or algorithms, even though that's part of it. The fundamental problem is human nature. It's the fact that we are more attracted to things that are more exciting in terms of information, that have more shock value, that disconfirm our hypotheses more strongly, right? This is the whole idea of clickbait, right? This is like, you won't believe what this celebrity said, right? And you're like, oh, what is it, right? This is it's playing on a sort of fundamental human emotional infrastructure. And the other infrastructure that is involved here is our tribal identities. America has broken into 2 super tribes, into a liberal super tribe, into a conservative super tribe. And these tribes, together with the incentive structure of media ecosystems, have formed large bubbles, for the sake of a better word, that serve as echo chambers for the distribution of signal, right? Oh yeah, you wouldn't believe what the Democrats did this week, right? And so so fundamentally, it's human nature, right? So I wish I could give you an answer that's, oh yeah, we just all need browser extensions, and oh yeah, if YouTube had better recommender systems, then all of this would be better, but I just don't see it, because fundamentally it's humans, right? By the way, the spread of misinformation long predates the internet. right? I mean, we had this on radio and we had this in newspapers and we had this, and over the years, over the generations, we had institutions grow that protected us against nonsense, right? We had sort of classical media, journalism, newsrooms. They had a code of ethics, a code of conduct. And to some extent, because the internet is so new, we don't have any mature institutions yet, right? So if you look at what Facebook's trying to do with its Supreme Court, that arbitrates disputes about content moderation, is a reflection of a tech company trying to grow an institution because they finally said, oh, we can't be in charge of this. Either you take over government or we build this quasi-governmental structure here to help us with it, right? And so as these technologies become more mature and as the engagement of society with these technologies becomes more mature, and as we see things go wrong in more and more ways, I think there's a natural response to grow these institutions that protect us against some of the stuff. It's just a question of, how many decades it takes, I think.
That's really interesting. Since more and more people from younger generations are starting to learn artificial intelligence, how would you say these people can join in on using AI to help change the world? What is your advice for a young adult interested in STEM, specifically AI, helping others and sort of following your footsteps, potentially pursuing that as a career?
That's an interesting question. So I thought about this. So there's an obvious answer which has occurred to everyone, which is make sure you learn mathematics, learn the fundamental methods that you need to be able to interact with these systems as an expert, particularly linear algebra, but these things are obvious. And of course, it helps to have diversified STEM training. So to the extent that you're interested in natural sciences, those things also help, right? I mean, artificial intelligence is inspired in large part by the visual cortex in the brain, or the sort of the reinforcement learning idea was sort of in part inspired by looking at the brain very closely. So there's a lot of things still to learn from the natural world about how to implement these things. But there's also a larger point that I think personally is more important. And I'm saying this in part because I'm at Stanford, where everybody's good at STEM, right? So even the social science majors are good at STEM, which is you can't really do interesting work as a scientist without being a mature and grown and interesting person. And what problems do you work on? What is it worth working on? Very often the big contributions in science are not mathematical sophistication or doing something in a more hardcore STEM way than the next person, but looking at a problem in a different way or asking, what do we actually care about here, right? I mean, think about the fact that it took people quite a while to realize that we were training all these machine learning models with a lot of bias, right? Racial bias because of the learning data. And there was just an intellectual monoculture among those who were building these systems. They were all very STEM heavy in their training, I can promise you that. But nobody thought to think of, okay, what are the implications of this? Where does this go wrong and who will suffer when this goes wrong? And so I think it's perhaps a little bit contrarian, but I actually think that one of the most important things you can do to have impact as a scientist or as a philanthropist or as a social entrepreneur or as an artist even, is actually see the world, particularly while you're young. I actually think it's quite important to travel, to take gap years, and not over specialize too early. That is a big, big danger, particularly in this environment here in Silicon Valley. As people in high school, they're already doing pretty advanced AI research projects, and that's great. I mean, right? You're sort of ahead a few years in one domain, but what are the interesting problems to work on, right? That drive the world forward? You have no idea, right? So so I think it's quite important actually to think about just human development in a broader sense, and then do the things that open up your mind to different ways of being in the world. The most effective way of doing that I found is traveling. I've taken 4-5 gap years in my career, where I've spent a lot of time in different countries, lived in different countries, speak a few languages. I think that that's actually incredibly helpful. So it's good that you want to learn STEM. You can certainly email professors and do that sort of thing. Do code academies and try to replicate papers, right? I mean, but those things you can always do in college. Those are things you can do in graduate school. What you can do is get these fundamental experiences later on, like traveling, right? The sort of being able to take a backpack and backpack through South America to do that sort of thing. You can't do that in your 30s. That's something you have to do in your late teens and 20s. And so I would encourage anyone, and if your parents have other opinions, then have them call me. But over specialization is actually your enemy. It's not your friend. It seems like your friend because you can earn a lot of money quickly, and it looks like you're doing a lot of progress. What you don't see is that in 10 years from now, your work will be profoundly uninspired and boring. And you're doing exactly what everybody else is doing because you're working with the same inputs, right? So give yourself more inputs, and to grow as a person, I think, is still the most important thing you can do to have any impact.
Yeah, thank you so much for that insightful advice. I think that is really true, especially for a lot of our culture. Like our school is based in Silicon Valley, so it's really useful advice for our listeners. And yeah,
I know. I get these emails from high school students pitching me pretty advanced AI research projects, and the response I always want to write back, but don't, because I don't want to offend anyone, is maybe you should go backpacking. And then once you've done that, you can think about, vector adaptation for, contextual embeddings.
oh yeah, that's really cool. And I think we are, I think maybe like 30 minutes in, so I know like you're really busy. So yeah, Dr. Eichstaedt, thank you so much. We really appreciate you coming today, and it was really great to have you speak to us. And I think I can speak for everyone. We learned so much from your talk. From like your advice, from your experience in your research, and just overall your amazing perspective as a researcher in this field. And so yeah, Dr. Eichstaedt, thank you so much for stopping by.
Thank you for having me. It was a pleasure talking to you.
Yeah.
Thank you, Dr. Eichstaedt.
Thank you.